हाय फ्रेंड्स, आज हम बात करते हैं एग्जामिनेशन ऑफ आईलिड, वन ऑफ द मोस्ट इम्पॉर्टेंट टॉपिक फॉर अंडर ग्रेजुएट्स स्टूडेंट्स एज वेल एज द पोस्ट ग्रेजुएट स्टूडेंट्स इन फॉर एग्जाम. How to examine a case of how to examine the eyelid. What are the important points in which we can assess the functional integrity as well as the pathological abnormalities of the eyelid? So we will discuss this examination of the eyelid in following points. The point number one is the position of eyelid. Normally the upper eyelid lying 2 mm below the superior limbus, while the lower eyelid correspond to the lower limbus. If there is any abnormality in the position of the upper and lower eyelid from these settings, then it is termed as the abnormal position of the eyelid. If it is lie below the 2 mm from the superior limbus upper eyelid, then it is termed as ptosis, while if it is lie above the 2 mm from the superior limbus, while the lower eyelid lie further below from the not corresponding the lower limbus, it is termed as the eyelid retraction. Normally the eyelid retraction is seen in thyroid eye disease as well as sympathetic overactivity, while in the ptosis is seen having various causes. Is the most common form is the congenital form of the ptosis, while the other is the acquired, in which there is a myogenic, neurogenic, aponeurotic type of senile ptosis, etc. So the position is very important. Next important point in the line of examination is the movement of lid. Eyelid movement is very important. Normally the eyelid blink about 12 to 16 blink per minute. The blink rate is decreases in case of trigeminal block, while the blink is absent, total absent blink is in case of a certain form of seventh nerve palsy. Lag of thalamus. Lag of thalamus is a condition where the eyelid, while an attempt, जब हम आंख को बंद करने की कोशिश करते हैं तो पूरी आई क्लोज नहीं हो पाती है. द कंडीशन इज टर्म एज लैग ऑफ थैलमोस. लैग ऑफ थैलमोस इज सीन इन फेशियल नर्व पैल्सी, extreme form of proptosis, as well as symblepharon, where the palpebral conjunctiva fused with the bulbar conjunctiva at certain points, and then there is an lag of thalamus. The attempt to close the eyelid, there is a tarsal, so there is a globe not completely closed. Now the next important point in line of examination of eyelid is lid margin. Lid margin is very important. Anterior lid margin, intermarginal strip, posterior lid margin, meibomian gland opening, eyelashes. These are the important structures where we must examine during the eyelid margin examination. So anterior lid margin, posterior lid margin correspond to the orbital globe. So then in case of ectropion, this posterior lid margin not lie in close contact with the globe. In case of entropion, this anterior lid margin or the intermarginal strip or this posterior lid margin intern towards the globe. Now eyelashes abnormalities is very important. Normal direction of the eyelashes in upper eyelid upward, outward, while in the lower eyelid downward, outward. So in case of the direction is an abnormal, अगर इससे कोई abnormal है तो उसको बोलेंगे straightening of the eyelashes or elastosis. In case of this elastosis, there is patient complaining of pinching of the lashes over the cornea or the conjunctiva that can lead to the irritation and watering. Now normal eyelashes number in upper eyelid is about 100 to 130, while in the lower eyelid it is about 50 to 90. The certain abnormalities of the eyelashes, like in tracheatic eyelashes, tracheasis means misdirected cilia or inward turning of the eyelashes. That this condition generally is seen in cicatricial form of the entropion or in case of burn, in case of trauma or chemical injury, lid marginal injury, where there is a eyelashes directions are internal. Now, dystichiasis is simply defined as an abnormal extra row of eyelashes. This is generally seen in case of certain type of infections. Now, madarosis is simply defined as loss of eyelashes, where the number of the eyelashes is decreases. That conditions is seen most commonly seen in blepharitis, in leprosy, in myxedema. The eyelashes as well as the eyebrow counts are decreased. Now, the important conditions where these are the conditions where the eyelashes and eyebrow counts are decreases. हम इसके लिए ट्रेवोप्रास्ट और विमेटोप्रास्ट यूज कर सकते हैं टॉपिकल सोल्यूशन के फॉर्म में. उसके लिए जो है हाइपरट्राइकोसिस ऑफ द आईलैशेस एंड ब्रोज जो अभी रिसेंटली इसके लिए ड्रग्स लॉन्च हुई है. नेक्स्ट इंपॉर्टेंट है पोलियोसिस, ग्रेइंग ऑफ आईलैशेस, जनरली सीन इन एल्डरली, बट इफ इट इज सीन इन द यंग पीपल देन द कंडीशन बी कीप इन माइंड इज वीकेएस सिंड्रोम, बोक्स कोयरागी हेरेडा सिंड्रोम. Scales seen over the eyelid skin. Scalings are seen in generally case seen in the blepharitis. We will consider and look for blepharitis. Swelling of the lid margin are commonly seen in case of stripe, painful swelling, painless swelling in marginal type of calagian, papilloma, nevus, marginal nevus. Okay, hydrocystomas are the various type of swelling. They are seen generally commonly present over the lid margin. Now, abnormalities of the eyelid skin. Abnormal eyelid skin are seen in case of herpes simplex, herpetic dermatitis. Now, molluscum contagiosum, warts, epidermoid, etc. They are the certain conditions where the eyelid skin abnormalities are found. Now, the next important point in the line of eyelid examination is the palpebral aperture. Palpebral aperture is there is an area and space between the two lid margin. That includes the two important points: vertical palpebral height and horizontal palpebral length. Vertical palpebral height BPH, the range is about 8 to 11 mm, while the horizontal palpebral length is around 28 to 30 mm. This vertical palpebral height is of significant importance. If it is decreased, then patients having difficulty in seeing. If it occlude the visual axis, then pupillary axis, then patients have difficulty in seeing the object. It can use certain chin elevation, head tilt, or the certain camouflage, certain adaptation, abnormal head position to see the object. So this vertical palpebral height decreased in case of enophthalmos, phthisis bulbi, ptosis, ankyloblepharon, blepharophimosis. These are the certain abnormalities where this vertical palpebral height is decreases. While this vertical palpebral height is more than the normal, the conditions is where the eyelid retraction take place in case of thyroid eye disease, where there is an extreme form of proptosis in case of thyroid eye disease, as well as the orbital tumors, and in facial nerve palsy, where the orbicularis stone is decreased and eyelid becomes lax. So these are the important points in the eyelid examination which must be keep in mind to examine a case where an eyelid abnormality or pathology are detected, and these points can be asked in examination.